It's my belief that this century, whatever we do should be informed by research, and that's basically what I have seen here. So it's like it is my belief. Most at times, why our advocacy for sort of making the impact that it deserves is because we do it on assumptions, we make it on hearsays. But with what the Gambia Participates have done, it really gave me that hope that there is a brighter future.
Gambia Participates works around issues of anti-corruption and promotes good governance, and of course also accountability and transparency. So what inspired this initiative is there is a need for data for citizens to actually also understand services that have been provided for and they are paying for. And we felt there is a need for ensuring that there is accountability in terms of governance, but of course also in ensuring that there is accountability in service provision in this country. And that was actually one of the main reasons that inspired this project. And we believe that looking into the services that NAWEC is providing, which is very essential in the lives and livelihoods of Gambians, and there is a need to actually conduct a study and collect independent perspectives from citizens, which we believe and hope that is going to inspire and improve service delivery by the service provider institutions.
problème na we xamuñ ko di pakunda dem daj fi ñi bari sa buñ fi dëkke problème ndox xade ta ñu taxu fi dem problème ndox mo leen fe jeni problème ndox nak yaga na di pakunda fi way legi la jina wos parce que bu ñëk ba do tok one month he ñasu pompe ñëwé gudi du ñëw be bëccëg pompe xej na time to time dina ñëw way legi mom over 6 months ben pépé ndox ñu legi dañoo séti mita bi sa ndax xalé dañ ko tej ndax dañu dog.
We choose NAWEC because they are the main providers when it comes to water. So and they need some type of check and balances. Yeah, so it's important to take a closer look of NAWEC in their water service delivery, and then hear from the citizens. Findings were not a surprise, obviously. Most of the findings were general knowledge, but then we deep further in terms of that is going to the communities. To find out more about the weaknesses in terms of water services, the loopholes, and then find possible ways to redress those issues.
So specifically on our project, we used community scorecards to assess performance of service delivery institutions. And these community scorecards, we actually reached out, or we identified communities that are we had a criteria, and in the criteria is we divided institutions that or communities that we targeted into 3 categories. And the first is we looked at the affluent communities that are the let's say the rich areas or community where people are residing. We'll also look at the income middle income earners, and then the proletarians, the people who live in communities where their earnings are very low, low income earning communities. And then we take each of these communities in these criterions, 10 from each. And then we actually conducted this research and survey in 6 communities, namely Banjul and Cape Point, which we categorize under the affluent communities. And then we went to Bakote and London Corner as the middle income earners, and then Ibo Town and Fajikunda as the low income earners. And then this is where we conducted this, and we collected data, and that data was filtered based on the information that was collected, and we looked into the services that they are receiving, whether first water is affordable, whether the quality that they are receiving from the service providers are up to standard, whether the quantity that they are expected to receive, whether they are receiving it, and then whether the continuity is also there. And then also, which actually helped us assess their earnings, we looked into the level of income that they earn, especially per household, who we believe are the main people who actually pay for these services, and how much actually they pay for these services. This is what we actually looked into during this research.
So most of the findings, or the main findings, was citizens were not very satisfied in terms of NAWEC water services. That is having water at night, late at night, when everyone else is at sleep, or having it very early when they are still at sleep. But then when it comes to the daytime, is an issue to have water supply. Not only that, the cost also, citizens are complaining that what they are paying, they are not receiving that services. So it calls for concern. So yeah, these are a few of the findings.
Mira jamna. Where ma? Hilang he. Ono business on. Joka sera. Marsuda? Sera. Do mi mandar nan client boy mi yagallo mi yani ma joni boy. Ndara le. Mi yagallo. Aye yagallo. Yeyi. Ko na jogi nyaman. Yandi jiare. Jiare, hajo angi jiare. Hajo ma non foti wonde jiare. Yandi jiare ko en foyo boy tak biata tax lempo. Ko sifa an e sifa madum aran. Ono be galle. Har kan jiande horema abokada e goto an tun jeyi galle ma yeyaade. An andi siko terrain on tuma darnaka walla galle darnade ha pare jiare no addi gadani ma ko wete capital gain tax hay sa anda noto on capital gain tax a foti mo yobbude joni on ko no mi yobbata mi ƴetta e mbodi de mi galle on fo boy mi ɗum ɗon e tambudi ma fo jonnaɓe de wona ɗum de on capital gain tax so ka yiyani mo hoorema ka yiyani hoore galle ɗen hoorema a foti yobbude 5% walla 15% woni percent sappojo temedere o sappojo a faami kon ka yiyani galle ɗen hoorema so woni noon compagnie o yiyani maɗe a wawi yobbude 10% walla 25%. ɗum ɗon no heddi e mbuuɗima ko yeeyiɗa galle ɗen ko no wondi e naforuji heewɗi kono fimi haalnama tun seeɗa o taxe o woni dépense laamu ngu on taxe yettata ɓe yoɓa police aɓe ɓe yoɓa faya service ɗon ɓen ka moƴƴina tali laawi ɗi ɗon ɓe moƴƴinita ɓe leɓitaji ɓe yoɓata jannoɓe ɓen ko école ji ɗin taxe ji ɓe yoɓirta ay nde wonde ɗon ndungu si ari ɗon ɓe roɓɓen ko marché ji ɓe tampa ha fi loope ɗen ƴetta ni mbuɗi ka yettata ɓe moƴƴina marché ɗe mi sanga andude après tampere o tampere ala ɗum ko ɓuuri yombude jiyaare place ji maɓɓe ɗum no heewi ɗon joni mi yahi mi hewta e jiyaare ni onon musidɓe a kala mo annduɗa ko jibbinan ndi leydi walla jooɗiɗen ndi leydi a waɗi wakkilade yoɓa koko ɓe wiyata taxe ko nafoore mum ko nafoore an Gambia yaara yeeso.
Of course, in every endeavor, especially of such, there will be huge challenges, and one of the challenges is that the scope of the project, it is a pilot project. We could not reach as many communities as possible because first the timeline, and of course also with limited scarce or limited resources that was at our disposal. And we tried to limit it to this number of communities of 30 households, which is not a representation of the entire country, but we believe as a pilot project is going to help at least for NAWEC to have a clue or an idea of what people are feeling, or their their perspective in terms of their service delivery. So the first challenge that we had was in ensuring that we get the accurate information that we need, accurate in a sense whereby when we wanted to actually collect some of these this data, you realize sometimes you don't find the household head in most cases, but because it is a research, we ensure that we collect information from maybe the wife of the household head, or a representative of that compound head. And this was one of the things that we felt. And of course also we could have maybe extended it to the entire, in other houses you realize some are renting, and you will have to collect in each of the houses maybe the information that is going to represent the entire household. And the resources, of course, also, like I said, were limited, and this has actually limited our scope of the research. But notwithstanding, we were able to actually gather the information from the people who were willing and ready to share the information with us, although some were shy to share with us the income that they earn. We wanted to actually gauge based on what they pay for and how much they are earning, which is actually to help us to see whether water is affordable. So some will just have to tell us, some will tell us or show us this as evidence, because it's an evidence-based research. We actually collect, when you say you collect 10 gallons of liter, we want to show what is that gallon that you use to collect data. If you say your bill, you pay $1,000, we want to see that you show us that. If you say you're earning $8,000, we want you to show us your payment slip. But sometimes some of these informations are private, so you might not be able to get all of that. So, but in most of these cases, people were very cooperative. We were able to get majority of the data that we needed from respondents.
Yes, we reach out to Pura, NAWEC, and then we hear from them, their side. But they agree to most of the findings, and for the good news, NAWEC is ready to collaborate with Gambia Participates to see possible ways to collaborate and then redress some of these water problems.
One thing that even I am going home with that hope is because of what I've been told by the Gambia Participates, that one of the stakeholders, which is primary in this, is NAWEC. And when the findings were presented to NAWEC, they were very much accommodating, and they have made promises that they're going to improve on their service delivery. So as such, I felt that as civil society organizations, we could rely on what is provided for us today and also mainstream it in our advocacy plans. Wherever you're going to use this is not going to be an assumption. If anywhere that you should meet NAWEC and say that this is what happens in Banjul, it's never going to be an assumption, because already the research is there to inform that basically this has been the view and not just the opinion, but what are the facts on the ground, and that is what is provided. So at our organization level, we are also going to make sure that we leverage on what has been provided, that anytime we do our advocacy, we also use it to inform the institution and also the citizenry that these are the status quo as it is now. So that will also help us reach out to more people and also help the institution to improve on their service delivery.
I would just like to tell NAWEC to be open up, in terms of more collaboration with civil society, and not to see them as here to detect issues and then disseminating issues, but then coming together to form an alliance, sort of, to work for the greater good. And then the citizen part also, let them come out, let them give their complaints to NAWEC, and together we can make it happen. Yeah.
Koran, ado.
Sorry.
Koran.
Sumon.
Ina mole. Ne korda wa. Ne profit sori. Inyente na la yele na mo jojang.
Yeah.
Ala na mo profit nyin. Kemo kemi nyane tan ni lulu nyanda wala jola jiare jang.
Ila keno me mula keno ya wa fe na mo jo fana kun.
Hako.
Mbo mo le.
Ade me mo la de.
Ha.
Dare de man reja.
Musa ya la keno la korda la wafi. Ala korda la wafi aka wala foyo ko anata wala jojang capital game tax to jang. Anata wala jojang. De kemi wo kemi sir la tang ani lulu. Ayanta wala jola.
Ila profit.
Momo ni alongo ika korda la wafi. Wala korda lo mbandi ko ka wala wafi. Ite nyanta nyin capital game tax jola jiare le.
Compagnie.
Ni atara dum fanan ibe compagnie le kono compagnie ye siyaso do je wala ye mandin kol ka fa mu ye ko niyo be je le compagnie nyin kono so ite nyanta munekela se kemi o kemi si latang ala fanna do bi je bo re jola ala fanna do bi je kemi o kemi si du lamuwan ani lulu ibo le jola adi bo jola min dola wala mun capital game tax to diare nyanta jola wala ko fe man ne jata ken ya bundal ne karamol ni ku kadol be ka bo namo ko aku jama ba ma ka bo namo ko
Amanda wala bakari. Nanyen stilo le niti nyata. Ana mo ka kataji yele.
Mbaju le ko mbaju nyande malam bang fo mun to.
Gambia
Kani
da
mi
wo
ni
da
hondu bi ajolo mun to.
diare la office be da wo da ni te futata je
E
e
ba
ko nata capital e game tax le jo damo nata wala jo ibajo la
Abaraka maro.
Yalo.
Inda de
Yo
ko.
mo ko nyamu ko mal.
yo bismillah okay abaraka
Mi na sala ko mbaju le.
yo bismillah
Bara.
yo musa bito badi molu al sinyi lonko banku di wo banku di ni atare ikata banku di tuwe manke banku di tuwo adi ka kenolo wafi wale ka kordala wafi ni ya wafi mun kuma ta je wale ta diare la capital game taxi to yeta yete la namojo
Today in the morning, I did not take bath. I have to use this kettle, my container kettle, to sight water from everywhere to clean myself. Look at the jegale masangunar, you know. So I feel so bad when I was coming here. I could not even clean myself the way I want. But as I am working in the media, I will also try to take steps to see how we can all collaborate.
You will not have water supply, and at the end of every month, you will be sent your monthly bill. Sometime last year, for 3 months, in my compound, we did not have water. We used to go to the Markaz Masjid to fetch water there, and it's like 250 meters away. So having to carry those 20 gallons of water, more than 10 per day, is hectic. And interestingly, we were sent a bill of 1,500 in the first month, the second month a bill of $950, and in the third month a bill of $1,050 without having water supply. So I think this discussion is timely and it needs to be addressed. If you are enjoying water supply, you should pay for it. But if you are not enjoying it, I don't think you should pay for it. And we had to pay our bills. So I think the discussion is timely and it needs to be addressed.
Because Sahel, we have known that when it comes to, producing a lot of visuals with standard professionalism. So I'm expecting also Gambia Participate to do more on work with Sahel when it comes to making documentaries. Because this only relies on people that can read and write. So it's very important when we make it on local languages, so we make them on documentaries. And Sahel is very good on that, so that we can get, because Gambians need to be aware. Before people get engaged or partners with such a program or such a platform, they must be aware. Because favoring nit ñi su nekkul ciow ci dëkk bi rek nawet duñ ko fulal.
So as such, it becomes a very much important event for me because of the facts that I have seen. even though the representation may fall short of the majority. But from what we have seen in the hall, the comments that were coming from other participants as well, basically with the number that they have, actually could speak for a lot of Gambians, especially those that are living in the Greater Banjul area. So it is a very important event for me, because this that is provided obviously has been informed by what the questionnaires were.
The reason why we conducted the dissemination workshop is to ensure that we have a collaboration with other civil society and media to ensure that this research findings is disseminated and is interpreted in ways where average Gambians can understand. And of course, also we want to also get government also collaboration in ensuring that these gaps are filled, and that is why we conducted a validation workshop with them to ensure to collect their feedback. We are very happy that we received feedback from NAWEC, who were very appreciative of this initiative, and then they've shared with us some of the reactions based on our findings, and they've shown willingness of improving on areas that they have their weaknesses, and they have called on for more civil society collaboration. And this is not for only Gambia Participates, but for the entire civil society and media. In this project, there are 3 organizations that collaborated in the project. The project is called Gambia Accountability Project. And I'm happy that one of the collaborators that actually are part of this project is Sahel. And then of course Activista. We all looked at 8 different areas, but almost similar in ensuring that there is government accountability and actually ensuring that we use information from these Gambians to actually inform government decisions and policies. And IRI actually funded this project. This is a pilot project, and we believe it's going to be continued. And then the recommendations of which we hope that this service provider like NAWEC would use to actually enhance and improve their service provision in the country. That's why we conducted this research. We also used a very unique approach, which is community scorecards, which is an unfamiliar tool, but very important tool in ensuring that you collect relevant information and data for government to use and improve in areas that they are lacking, but not only that, but to understand from the perspectives of citizens whether they are satisfied with the services that they are providing and whether there is a way that they can improve. And this is not only just to try to find out the faults, but of course we hope that we as civil society, we are actually also meant to complement and collaborate with government to ensure that we provide better services for our people.
In their service delivery, they must be accommodating to the civil society organizations. In our advocacy, we are never wanting to take the role of the government. We can never be duty bearers. But what we do as civil society organizations is to make sure that institutions are held accountable, institutions serve the purposes that they are created, and also make sure that we give the power to the citizens they deserve. Like I've said, one of my friends would say that nobody lacks the voice. It is just unfortunate that they have not been given the mic. But for those of us that have the mic now, we could also make a difference until these other people will be given a mic. When they are given the mic, they speak for themselves. But when they are not given the mic, those that have the opportunity must make sure when they speak, it reflects their general wishes and aspirations. And that's what we'll continue to do.
So what I want to also urge others is that, especially my colleagues at the civil society, that we should actually try to find, to collaborate amongst each other, but of course also to reach out to government institutions to ensure that we try to collaborate with them so that we will help, improve their services, and then in terms of the work that they do, which will trickle down to even the last, person in the rural communities to benefit maximally, in maximum way, in ensuring that it improves their livelihood and their living conditions.
The way forward is more of advocacy, more of collaboration with public institutions, especially NAWEC, to collaborate more and show them that we are not here to sabotage their services, but also to show them that we are ready to collaborate. And there are some things that NAWEC cannot do, but as civil society, there are things that we are good at, especially the advocacy part. Then we see a way forward, find possible ways to collaborate with NAWEC to solve these issues in terms of water services.
And for civil society organizations, let them continue the push. The citizens will have to be informed before they could hold their government institutions or individuals accountable. If they do not know what their rights are, obviously the basic necessities of all of them will not be provided as it is required. So as NAWEC, let them make sure that they improve on their services. Any effort we do is to complement their efforts that are already on the ground. So if we come with things that are basically informed by research, they should accommodate it and also be willing to work on those shortcomings for a better Gambia.
Dr. Ismaila Badji from Innovarex Global Health. Bëggoon a waxtaan especially ak ñun ñoo xam ne maguñ Gambia bi soo seetlee coronavirus bi léegi ñun ñoo xam ne maguñ noonu duñ ko dee jël as serious as possible waaye virus bi yàgg na suñ biir mais nga xam ne fu mu nekk nii mag xale ñëpp a war a dem pengu ji yàggoon na amuñ pengu yu bari pour nit yi waaye fu mu nekk nii yàlla ubbi na suñ wërsëg pengu yaa ngi si dëkk bi soo ku nekk war naa mën a xam fu la gën a jege nga dem nga pengu buñ seet ne rek ñun xale leñ suñ yaram yaa ngi yëguñ dara suñ yaram yi waaye suñ mag yu nekk suñ kër yi ñun suñ pengoo ñoom lay gën a dimbale te feebar bi tamit faalewut ndax nit mag nga wala nit xale nga ñëpp a nekk on the same playing field xam nga feebar bi yàgg na suñ biir ba nga xam ne ñu bari ñuñ gën a bugga ñàkk nañ leen nit feebar bi soo gis nga nit ki soo ñàkkee koo bugga nit feebar bi nga gestu nga gis keneen mu ngi oyofal feebar bi loolu naxar boobu rek baaxul sax pour mu dëkk suñ biir soo lu ñu war a bàyyi xel la parce que Gambiens yu bari nekkatuñ fi suñ kilifa yu bari nekkatuñ fi soo lu ñu war a bàyyi xel la lu ñu war a bàyyi xel la waaye feebar bi moom fu mu nekk nii wax werante ndax mu ngi fi wala nekk fi loolu passé na cause yaaxa bu mu def si dëkk bi dafa feeñ ba pare soo maa ngi just urge xale yi mag yi ñëpp ñu ut fuñ mën a dem péngoo ñu péngu bi ñu ko war a seet yëpp pour make sure ne lu baax la def nañ ko ba pare soo nekkul loo xam ne dañu koo jox te baaxut waaye loolu rek moo ñu mën a dimbale cause virus bu nekk suñ biir demut fen so please nañ ñaan nañ waxtaana suñ xarit yi waxtaana ñoo xam ne dañu dee déglu nit su ko dooree di jël rek da ngaa gis ñeneen yi dañoo gën a comfortable pour mën a jël péngu bi so please nañ taxaw si péngu bi.
miɗa andi yimɓe ɗinin jiiɓi seeɗa affaire vaccine he because miɗen gaddi vaccine ji ɗiɗi ɗi wonaɗi gootum first vaccine o on ɓooyi ɗum woni HPV vaccine gokkiteɗe sukaɓe rewɓe e nder school je on vaccine ko dandata ko ɗum woni damal ɓesgu ñaw mbiteɗo cervical cancer ko on okkete sukaɓe pour danda ɗumen cervical cancer noon woni cancer mo ganduɗa ko on nangata damal ɓesgu rewɓe ko ɗum tagi ko sukaɓe rewɓe tan gokkete on pingu ko dandata ko ñaw mo ganduɗa ko nangat damal ɓesgu rewɓe ko on wiyete cervical cancer pingu so oɗo pingu covid vaccine ko mawɓe ɓe gandu yimɓe ɓe ganduɗa ɓe keeɓi duuɓi 17 yeehi to dow ko ɓen pingete on so sukaɓe rewɓe wonɓe ɓe school aji wonaɗi gootum yimɓeɓe no paamɗin ɗiɗi te pingu o ardani ko hadgol sukaɓe rewɓe heɓgol ɓesgu no pingu o ardani ɗum saabu minen sukaɓe amen ɓe pingima te musidɓe amen sukaɓe amen ɓe pingima so sa daari si taw woni ko hadgol ɗumen ɓeygu nden min kadi sukaɓe amen ɓe ɓeygu min kadi sukaɓe woɓɓe ɓeygu te wonaɗe gootum wona gonga.
There is no evidence to show that the COVID vaccine is related to any blood clot. Though if more than 100,000 people or 1 million people are vaccinated, even without the vaccine, those people could still have blood clot issues well before the vaccine. So, but there is no evidence that is to show that the COVID-19 vaccine have any causable relationship with blood clots, though they were accused of it earlier. But after the people who accused them, they themselves, that is the European Union, went on to do their own investigation about the relationship between the blood clot and the vaccine. And after came out clearly, well before even WHO already told them that the vaccine is safe, it doesn't have any cause for any blood clot.
Komin nga fo nyamin coronavirus pengo ata fanan sahatale anda beteatale fana wala mu kamol tankande nga mo jamal le pengu coronavirus pengo la min tata ko mo wuli tan saba anin feng nga wolle pengu min coronavirus pengo la bari nene mammo soto mi yalon ko ka fo nyim pengo le asabu asasata waranto ka fo nyim pengo le suntala saya
si Europe bi mooy European Union si njëlbeen bu vaccine bi génnee ne pengu bi dafa tax ñenn ñi ñu am jafe-jafe seen deret yi du mun a daw normal nu mu war a dawee wala dina dee am i texa waaye yooyu tamit scientists yi wala docteur yu mag yi def nañ ci i gestu waaye gisuñ si benn firnde luy war a méngale yëfi deret bu ñaax a dox boobu noonu.
Comme covid pingu o ɗini heɓi probléme o okkati yimɓeɓe probléme min mi yiyani ɗum sabu minen min pingi yimɓe ko yahata yimɓe guluje 50 eko fawi te min jiyani hen hay goto mo ganduɗa ari wi minen ko o pingu wari ɗum walla ko o pingu haɗi ɗum wadde hajuji muɗum ɗe so a yiyat o pingu min pingi Adama Barrow pingima yimɓe hewɓe pingima hay wona sengo gon sengo minen office amen o fof pingima min on jigi jodiɗo ɗo mi heɓi pinguji am ɗiɗi ɗi fof mi ɓangi ɗi te hay hunde waɗani kam te min gorko am o ɓangi ɗum baba am ɓangi ɗum oncle am ɓangi ɗum ay yimɓe hewɓe ɓangi nene am ɓangi so si ɓen fof ɓangi si ƴetti pingu o ay dara ɗum waɗani ɗumen nden mi sikkani ɗum waɗa goɗɗo ne dara sabu min jiyani hen hay ko wiyete ko blood clotting Gambia heɓani on case.
People should understand that the COVID-19 vaccine, the time it was being prepared, it have reached all the corners of the world. There was a global, effort that was put together both technically, both financially, and both morally, and both academically, to make sure that everybody, whatever you have, if you have finance, you bring it. If you have technique, you bring it. If you have equipment, you bring it. If you have knowledge, you bring it. So this was what created the COVID-19 vaccine in the fastest record time.
Kafo penko nyin dadata tariyakele to nyalema tariyata bar min beje mol bebe dula kilenne katun coronavirus e dunia bele ma kodo min nyanta dépasse laje a bebe larine andum londo fana londitiol milliardon ko nyanta do ko keno la karola wol be nyata ke multi milliardon ko asotota nyama andum a be do ko nyin soniyata katun kodol lebe landiring amanke ko koy bita kodo nyinin ka bita approval nyinin nadula do to waranto be mol scientist ol kumandila ime bendino wo be man soto katu mo be dula kilineje ben tankandiro soto lanya
pengu bi nak pour ne warlo ko jël ndik diiri waxtu buñ ko defar rafa gata lolu dafa am fuñ ci sukandeku te ndik société coronavirus pengu bi jamono buñ ko defar dafa feka wërna aduna yépp daj ko te loolu wara tax kon xel wara nangu ne kon scientist yi wala docteur yu mag yu nekk ci aduna yépp ñëpp ñoo booloo jàppante gis ne amal nañ feebar bi ni vaccine
o mo fewna e nder hitande ko fawe gonga minen mbowan hebde vaccine ji ɗi ganduɗa ɗiɗi pewna e nder hitande o gonga kono sa ndari covid-19 vaccine ko ganduɗa ko scientist ji kewɗi ɗum woni jomaɓe gande kewɗe ngari battidiri jomaɓe jawdi hewndi ari wattindiri ɓe fof ɓe gondi hunde wotere ɓe liggi o wattu goto si tawi wonino ko dula goto soluno pingu o ɗon wonanno caɗele saabu tuma ha keɓannoɗa jawdi ndi walla tuma ha keɓannoɗa yimɓe ɓe jomaɓe gande ɓe hawrindingol ɗumen weeɓata kono ngol ɗo yimɓeɓe fof kawriti woni hunde wotere kulle ɗe fof liggama e dow waktu goto ɗum fof hawriti ko ɗum taki pingu o yaawi wona wonde hen ko pingu o ko jawnaɗo pour yawno rek pour waɗa ɗum wona tan waɗama ala pingu o no fotiri yaride ni fof yaari noon saabu WHO larata pingu mo ganduɗa waɗiraka he lawol okka ɗum permission ko ma mbaɗira no fotiri ni e dow lawol ɗum mbawama okkude certificate o ɓe mbiyama joni ya continue mbaɗa ko poɗɗa wadde ko.
To everybody out there, if you once have the virus, you were once positive and now you are cured of the virus or negative, it's advisable for you to take the vaccine to have a permanent immunity.
Komin natara e kafuko ko misal fen tenga coronavirus sotore ɗum amanjere nga pengota hani nyanta ka pengotale han natara nga coronavirus ta soto ɗum komin nga courant sotore hani bi nyanta ka pengota pour kam fan tankandi nin atara bala sojaro nin atara courant ni dun tambalo kono akan tam mantore ko tanke
ko xamne amna coronavirus won te nga tane wala nga wér ndax feebar bi doo ko mën a amaat te loolu nekk na loo xam ne jàngat nañ ne am na ñu amoon coronavirus daaw te balaa ren sax ñu amaat coronavirus kon ben tey docteur yi ñu ngi am jàngat feebar bi ndik lu ees la te ben tey ñu ngi jànga te xibaar buñ ci mën a jot rek dinañ leen ko baaxee waaye ben tey wane wuñ ne comme ku amoon feebar bi doo mën a amaat feebar bi kon li ñoo digleel ñëpp rek mooy ku amoon feebar bi ak ku amut feebar bi soo amee chance pour jël pengu bi nii jël ko loolu mooy sa aaru te loolu mooy tamit loo xam ne mun na la fanxa si feebar bi nii.
comme misal neɗɗo heɓino coronavirus comme heɓino ñaw coronavirus o immima jarani heɓgol pingu ala ha joni aɗo jari heɓde pingu o aɗo foti heɓde pingu o nda ko keɓɗa ko ñaw o takani wonde hen an ha joni a wawata heɓde ñaw o aɗa wawi heɓde ñaw o comme no mbimi ni aɗa wawi heɓde ñaw o te aɗa wawi mo wattirde ne.
COVID-19 vaccine cannot give you the virus itself that will make you sick. It will introduce some form of the virus in your body, but it will not be a virus that can make you sick. So people who have taken the COVID-19 vaccine cannot be, severely or made to die or get sick from the COVID-19 virus, because the form of the virus that they are having is just for prevention, and that is just to allow the body to be prepared in the case the real virus comes in.
My name is Dr. Ismail Abaji. I'm a pharmacist by training. I was practicing in the US for a little bit over 8 years. And currently I'm the founder and CEO of NAWEC Global Health. IGH is a healthcare solutions company that opened in the Gambia, just focused on delivering quality healthcare to people all over the country. Lies go around the world before the truth catches up. So we're catching up to misinformation that came out earlier than the vaccines did. So I think a lot of people fundamentally don't understand how important vaccines are, not only for COVID, but humanity. Things like smallpox, measles, chicken, all these different diseases that used to wipe out nations, is because of vaccines, we don't talk about them anymore. And the tragedy is Gambia has actually had a very successful track record in vaccination. So we've always been a nation of people who took vaccinations. But if you talk about the COVID, I think the reason why it's so important is all Gambians should understand what our reality is. We're not a country that could shut down because then the economy dies. We're not a country that's not going to stop social gathering because we are inherently social people, so that cannot go away. So it leaves us with two options. High exposure, which a lot of people are gonna get sick. The more people who get COVID end up in the hospital, and a portion of that in the hospital may not make it. Vaccines is the only way where you could minimize the amount of people who both get sick, or if they do get coronavirus, it's not as bad to a point where they need to get hospitalized. So I think it's just our current reality. We have to know that the smartest people in the world have collaborated on the coronavirus vaccine, something that's unprecedented when it comes to vaccine development. Some of our Gambian brothers and sisters who are working at these institutions in the world. So now that we had a vaccine shortage, we have provisions now. So the ball is in our court. We have a role in how the next couple of months becomes for us. And I think vaccinations is our only saving grace, because once again, shutting down the economy, telling people don't mingle with people, those are not realities that we could ascribe to. So it's just so important for us to build our systems, and vaccines are just the most protective thing we could do at this point.
Ka misal fe ninga vaccine ota wala ninga penkota aske kurang ke sole bije membati nalante kurang coronavirus kurang soto wonten toñade nyim vaccine o man dada kurang ke sola dada taminna wonin kurang ke so man kiliya so e bajela ko hanna tara e penkunin vaccine ola wote kurang ke so nyin dile ando ate kurang o dile
ñaxa fi coronavirus bi ndax dina tax yow nga am feebar bi déedéet ndig ñaxa bi wala pengu buñ la jox loolu mënut la feebarloo lu moo def ci yow rek mooy pour mu yokkal kaatan dugalal la i soldaar wala ebal sa yaram bi mu defar i soldaar yoo xam ne feebar bi su ñëwee ci sa biir yaram dina leen mën a xeex.
yimɓe ɓe ne ɓe mbiya comme sa ɓangi covid-19 vaccine aɗa wawi hen heɓde ñaw o min mbimi wona noon saabu covid-19 vaccine o ala ɓiɗɗo ñaw o pour mbawamo okkude on ñaw so covid-19 vaccine ɗi fewnira e hunde nde ganduɗa tawaka e ɓiɗɗo ñaw he so on vaccine wawama okkude ñaw o
19 vaccine side effects are not known to be dangerous. The side effects that we know of, as we said earlier on, are fever, maybe headache or joint pain, which are not known to be dangerous. And there is no contraindications to people even who are pregnant or who are breastfeeding that if they take it, it will be very dangerous to them. There is no evidence of that. So, and even people who are breastfeeding or pregnant can take the COVID-19 vaccine. So there is no danger or form of danger effects that are related to the COVID-19 vaccine as of now.
Comme kafo mantoro soto pengola karola wasi mo fanole mantorol mil boko kundimo ni balakando anin chokidimo ni ya fo juna o ni paracetamol ta nyanta bolale bar tumando penko fana asimol dol balo batandino la asimol balo makuyale bar ning atara yewo jedron nyanta reporting kala bar natara wo fana manke no watila tumando be batandela bar kafo ko abe mo fano la manjiki ko o be futano la woto
so jëlee ñaxa pengu bi ndax ding ci am i jafe-jafe yu la mëna rey déedéet loolu jàngut ko fen te ben tey depuis buñ dooree di joxe pengu bi ni maaj ci Gambia bi ben tey amul kenn koo xam ne am na jafe-jafe bem ci ñaaka bakkenam te ci biir aduna bi tamit ñu ngi bàyyi xel di follow di seet yeneen dëkk yi nu ñoo doxalee te yooyu tamit dégguñ fa benn xibaar koo xam ne pengu bi moo indil borom jafe-jafe bem ci war a ñàkkee bakken
min de mandargaji ɗi jimi ɗi pour sa ƴefti pengu o mandargaji ɗi mbimi ɗo ɗi ko hoore musande e cokki musoji e nguli ɓandu ko ɗi gandumi he pengu e ɗi waɗi nak tawat woɓɓe no ko jiita he ɓalli mumen ko tawat wona fi vaccine o sabu neɗɗo ɗi wawi ɓangde hayso ko ñamete woɓɓe ñamete goto tawat an ɗum tampinama walla ɗum wasama tampinde kono tampinat goɗɗo so ko noon vaccine ne wayi aɗa wawi ɗum ɓangde ɓaŋoya goɗɗum walla tawata koye goɗɗum jiiɗa hoorema tawa wona vaccine o kono tawatta yimɓe coɓi vaccine o ɗum foof ɗo wawi wonde kono noon vaccine o ko kalmi ko yimɓe guluje 33 heko fawi ɓangi ɗum te mi yiyani hen walla mi nanani hen report mo ganduɗa taw ko neɗɗo mo ganduɗa ko ɗum ko vaccine o waɗi ɗum
60% of Gambians believe that prayer do more to protect them from COVID-19 than the vaccine itself. Actually, we all know that no matter how prayer is answered, but you also have to put in the effort, put in the work. So if you believe that prayer do more to protect you from COVID-19, but it will do best when you also have your COVID-19 vaccine, add that with your prayer, I think you will have a more better protection, even up to 100% of protection, than just believing in prayer and not taking in the vaccine.
I think especially with the Johnson & Johnson, it's one of those things where it's how information is received. What people need to understand too, it's not the United States who just dumped vaccines in Africa. This is part of the COVAX program. It's a part of a lot of key stakeholders, international organizations around the world who also understand the reality of Africa. So all the regulatory bodies have proven, even now with the Delta variant, that it's a safe and effective vaccination. I think right now the world is always going to battle, misinformation, conspiracy theories about the vaccines. But all the regulatory bodies in the world, not only the United States, have approved it. But more than anything else, the Johnson & Johnson, why I think it stands to benefit Africa better, is because of how effective it is. It's a logistics nightmare to track down Gambians to take 2 shots during the right sequence. Now we have a golden opportunity with a vaccination in the Johnson & Johnson that's proven to be safe and effective. Once again, not in preventing coronavirus, but preventing hospitalizations and death from coronavirus. And it's 1 shot. So 150,000 vaccines, that's 6% of our population. So the biggest opportunity is understanding the difference between the vaccines. It's easier to administer 1 shot and you don't have to come back again. So it's just something that people need to understand. All the individuals who are in charge of the welfare of humanity have ascribed that this is something that could be efficient. So we should be celebrating the fact that we have a more efficient vaccine in terms of administration and not casting, misinformation, because the person who might believe the misinformation just might be the unlucky individual who gets COVID and becomes sick enough or does not make it. So I think the conversation needs to start with us who understand educating people about it, but also everybody has to have their hand in this as well too.
Born and brought up from Igbo Town. I am the CEO and the founder of DJ's Enterprise. Basically, I do poultry. I am a BSc holder in accountancy from the UTG. I can say in my whole life, I've been into many businesses, though some of them I just started and then it ended not being successful until last year when I attended the Emperotech training, entrepreneurship training, which was for 6 days. From this, I had this suggestion from a friend who is doing poultry, but he's a male friend. Yeah, he told me that
he always encourages me and tell me, you can do this. Why not you try poultry? Yeah, it's something like it's a good investment. So from there, I had this idea, and then I started up. Like from the training, we were later given our transport refund, which I used, and then I was like, why not I get something from my saving and then ask an uncle to support me to start up this poultry. So from there, I just took that money and then built a small house where I was able to rear like 50 birds last November. Yeah, which was my first batch. Yeah. Then from there, that's how the poultry business came about. It has really not been easy, but then we just say Alhamdulillah that at least we are engaged into something. Yeah. So basically it was not easy, but then Alhamdulillah we were able to cope. Yeah, really it was not, because you can see that poultry business is not something that is it's not easy. There are a lot of risks involved in it, because you can see that birds can easily get infections with bad management. But then during my first batch, I wouldn't say it was bad, because Alhamdulillah I was able to get just 5 casualties, which I think was not something very bad though, as hence it was my first batch and there was no experience. Yeah, and that was the only batch I have did so far, though I'm aiming to get to rear more bats, inshallah, soon. Okay, it's like I would say having the opportunity to go into the Standing for Youth initiative, which was conducted by the IOM, which really was something that really supported me to be able to continue this my business. Hence, after the training, we were supported with a grant, which we have to utilize, and which would really help me in this industry. It's like I have learned new things. Hence, before I only know of like that I need to register my business without even knowing that I needed a trademark. I needed to pay like to get a trademark, and then like for future purposes. This is something I have learned, and then also I got to know that there is this thing that is upcoming, which is like we need a startup act for us as entrepreneurs and for us as startups. And I am aiming to follow the procedure to be able to know of this act. It's like it's really not something easy, but then with determination you can do it. You don't always have to. It's not like everyone will be able to sit in offices. As you can see me, I am someone who did accountancy for 4 years, but then I know that not everyone will have the opportunity to sit in office. So with the little I had, I am able to get something, and with this I will be able to empower other women, and I will be able to provide employment opportunities for the youths in the country in order to reduce in order to eradicate irregular migrations and the like. So with this I am saying that just have the determination and make sure that you get something of your own which can help you to empower people.